This session focuses on preventing, recognizing, and responding to pesticide exposure. It's based on information found in Chapter 5 of the National Pesticide Applicator Core Study Manual. When and where do you think pesticide handlers can come into contact with pesticides or pesticide residues? I'll reinforce some of the answers you just provided and a few additional ideas included on this slide. You can come into contact with pesticides and pesticide residues when mixing, loading, or applying pesticides, cleaning, repairing, and inspecting application equipment, responding to emergencies such as spills, handling labels or open containers, checking pesticide storage areas, or working in treated areas. I have two more questions. What are the routes of entry through which pesticides can enter your body? And which of the four routes of entry is reported most frequently among people who work with agricultural or structural pest control products? The four routes of entry are through the eyes or ocular, nose or inhalation, skin or dermal, mouth or ingestion. Of the four routes of entry, skin exposure is reported most frequently among people who work with pesticides in agricultural or structural pest control areas. This is not to say people who work in greenhouses don't need to worry about inhaling pesticides, or if a label doesn't require eye protection, handlers don't have to worry about pesticides splashing into their eyes. Every situation and workplace is different, and so we'll expand a bit on pesticide exposure through the four routes of entry and how to prevent those situations. I have four pictures of situations that could potentially lead to pesticide exposure. The first slide shows a potential eye exposure scenario. What's happening in this picture? The person is adjusting the nozzle on the sprayer. If the sprayer has pressure, the pesticide could spray into his eyes and he isn't wearing the right eye protection. The person has reading glasses, which will enable him to see what he's doing. However, because those aren't safety glasses with side and brow protection, goggles, or a face shield, which are all designed to prevent chemicals from splashing into your eyes, this person could get pesticide in his eyes. The equipment is probably still pressurized, and the spray droplets could very easily spray up into his face and eyes. Here we have an inhalation exposure scenario. What's happening in this picture? Look closely at this guy's face. He cut a hole in his mask so he could smoke a cigarette. There's a lady next to him and she's too close to the application. How would you prevent this type of exposure? Never alter your PPE. Don't smoke when you're working with pesticides or when you're near pesticides. Make sure there aren't any other people in the area when you're handling pesticides. Remember that PPE is designed to protect pesticide handlers from exposure to the specific pesticides they're using. Altering them in any way, like cutting holes in the sides of coveralls so you can reach into your pockets for your cell phone, rolling up sleeves, or tying the sleeves of one-piece coveralls around your waist, defeats the purpose of protective equipment. Now let's talk about skin exposure. What's happening in this picture? The man's wearing shorts, a short-sleeved shirt, and isn't wearing gloves. His skin is exposed to the pesticide. This photo was staged, and the person in the photo is working with sand. However, you noticed he's wearing shorts and a short-sleeved shirt. If he was using a granular pesticide product, he could potentially get exposed to the pesticide through his skin. How would you prevent this type of exposure? Wear all the PPE listed on the label. Even if the label requires protective clothing and no additional PPE, he must wear a long-sleeve shirt, long pants, and shoes that don't absorb pesticides, or at least something he's willing to wash at the end of the day and store at the work site. If this person was applying a granular pesticide to this baseball field, he would need to wear all the PPE and protective clothing listed on the pesticide label. We'll elaborate a little more about different types of PPE and protective clothing during the PPE presentation. However, you did notice he would at least need to wear long pants and a long sleeve shirt to protect his skin from coming into contact with the pesticide. This last photo shows a potential ingestion scenario. What's happening in this picture? The person is using a measuring cup that looks like a regular drinking cup. The measuring cup needs to be one that's designed specifically for measuring pesticides and labeled as such. Someone might see the measuring drinking cup later and put it back in the kitchen or break room, not knowing it was used for pesticides. To prevent this type of exposure, only use measuring devices designed for use with pesticides. Thoroughly wash the measuring devices immediately after mixing them, and make sure you put them away. Make sure the measuring devices are labeled for pesticide use only. People who work with pesticides or in areas where pesticides are used might ask, how hazardous is this product? They're concerned about the potential for those pesticides to cause harm and the risks involved when using pesticides. The hazard is directly related to the toxicity level of the pesticide. Is it acutely toxic? What's the signal word on the label? What are the long-term health effects? What is the pesticide? Will a person be working with the pesticide in its concentrated form, for example, when mixing or loading the product? Will they be in a pesticide-treated area after the REI is expired? These are all important factors. The way a person's exposed to the pesticide also is a factor. Did they swallow it? Did they splash it on their skin? How much were they exposed to? A lot of people get nervous when they see this equation in the study guide. However, when you break it down like we just did, it's easier to understand the concept. Most pesticide handlers have background knowledge about the information we just covered, such as the routes of entry and how people can get exposed to pesticides. They also have a general understanding of different types of symptoms that might be related to exposure. Chapter 5 contains terminology you might not use on a regular basis, such as acute and chronic exposure and local, systemic, allergic, and delayed effects. We'll cover those definitions in the next few slides. Local effects pertain to injury at the point of contact. This is actually a picture of a reaction to poison oak, but the concept's the same. The rash appeared where the poison oak touched his skin. Symptoms might include skin discoloration and irritation, dermatitis, redness, rashes, blisters, and burns, or swelling, stinging, and burning of the eyes, nose, mouth, or throat. Systemic effects occur once a pesticide has been absorbed and distributed throughout your system or your body. A person might experience nervous system disorders, cancer, impaired metabolism, hormonal effects, kidney or liver damage, or blood clotting problems. Allergic reactions are fairly straightforward and probably commonly understood. A person might have or develop sensitivity to a particular substance and suffer from dermatitis, blisters, hives, itchy eyes, asthma-like symptoms, or shock. Now let's compare acute to chronic. We covered this in an earlier presentation when we discussed the LD50 results and acute toxicity, but now we'll differentiate between acute and chronic exposure, appearance of symptoms, and health effects. Acute exposure is a single one-time exposure event. Remember the LD50 activity from our previous presentation? Chronic exposure can be long-term exposure or small repeated exposures over time. There are tests on laboratory rats or mice for the duration of their lives, which is usually about 2 years. Acute symptoms usually appear within the first 24 hours of exposure. Chronic symptoms are long-term and develop over time. We'll talk about delayed effects on the next slide. Note that both acute and chronic effects can be caused by contact or systemic exposure. A few examples of acute effects are immediate respiratory problems or eye or skin irritation. Effects of chronic exposure might include any of the following: liver disease, fertility and reproductive problems, cardiovascular disease, nervous system disorders, or tumors. On the last slide, we covered acute and chronic appearance and effects. Some symptoms might not appear within the first 24 hours after exposure. In fact, some might be delayed for weeks, months, or years after either an acute or chronic exposure. True to definition, they are delayed effects. It can be difficult to determine if a set of symptoms is caused by pesticide exposure, the flu, food poisoning, or even heat stress because symptoms can be very similar. For example, this slide shows a comparison between symptoms of heat stress and those that might occur after exposure to organophosphate or N-methylcarbamates. Organophosphates, or OPs, and N-methylcarbamate pesticides are of particular concern because exposure might lead to nervous system disorders such as Parkinson's disease. It's important to recognize potential symptoms of exposure. Interestingly, several of the symptoms are similar to heat stress symptoms. The box on the far left includes the similarities: sweating, headache, fatigue, nausea, central nervous system depression, loss of coordination, or confusion. What happens as people get overheated? They start to get dehydrated, right? Here you'll see in the middle box of symptoms, they relate to someone whose body is basically becoming drier and drier. Dry mouth, clammy, hot, and dry skin, lack of tears or spit or saliva, a fast pulse, dilated pupils, or fainting. The opposite occurs with exposure to OPs or N-methylcarbamate poisoning. Symptoms include excessive salivation, tears, diarrhea, a slow pulse. Something unique to severe exposure to these pesticides is small pinpoint pupils, coma, and in long-term severe cases, exposure to these pesticides could lead to nervous system disorders such as Parkinson's disease. You can do everything in your power to try to prevent pesticide exposure. However, sometimes it still does occur. Therefore, it's important to know how to properly respond and assist people who have been exposed to pesticides. The pesticide label and SDS documents have key information medical professionals can use to better assist through suffering from pesticide exposure. A clean SDS or even cell phone photo of the front of the label with brand name, manufacturer, ingredients, and EPA registration number are helpful. This will include information on the active ingredient and the first aid instructions. It's important to know how to respond to pesticide mishaps. For example, if someone gets pesticide on their skin, it's important to remove any pesticide-contaminated clothing, wash the contaminated skin with soap and water, and some labels might recommend rinsing or washing the skin for 15 minutes and seeking medical attention if irritation persists. Decontamination supplies such as water, soap, single-use towels, and a change of clothing must be readily available for you, including at the mixing and loading site. Liquid or bar soap is fine, but not hand sanitizer for two main reasons. Hand sanitizers contain alcohol and might react with the pesticide you're using, causing more irritation. And people wash soap off their hands, but they move hand sanitizer around their hands. Therefore, they're not actually removing the pesticide residue from their hands. What product is missing from this photo? The answer is single-use towels. It's not uncommon for a decontamination site to be out of towels. Single-use towels are not towelettes or wet wipes, which might also be alcohol-based. The change of clothing can be an extra coverall or an extra shirt and pants. Anything you can put on if your work clothes or PPE become contaminated. You'll need 1 gallon of water per handler, plus a pint of emergency eye wash if the label requires eye protection. Let's review the steps for responding to someone who gets pesticide in their eyes. Rinse the contaminated eye for 15 minutes with a cool stream of water, either clean running water or bottled eye wash. Rinse from the inner to the outer corner of the contaminated eye. If the person wears contact lenses, remove the lenses and continue rinsing the eye. Inhalation exposure can be tricky because you want to get the person to fresh air as quickly as possible, but you don't want others to become exposed to the same pesticide. Therefore, if the person is in an enclosed area and appears to be unconscious due to pesticide vapors, do not go in to rescue the person unless you have the proper respiratory equipment. In fact, the best plan is to call for emergency services, such as the fire department, and explain the situation so they can come prepared to rescue the person. Each pesticide is different, as is the way you need to respond to a person who swallowed a pesticide. That's why it's especially important to read the label for that pesticide and follow the first aid instructions. Some labels recommend vomiting, and others state you must not induce vomiting. Other labels will recommend you give the victim water to sip, egg whites, milk, gelatin, or activated charcoal. Never give any food or liquid to a person if they're unconscious. If you're an employee and suspect that you've been exposed to pesticides at work, you have the right to receive medical treatment, information about the pesticides that were used at your work site, transportation to the nearest medical facility. You should not drive yourself to the doctor if you're ill. You don't have to be 100% certain your symptoms were caused by exposure. You still have these rights, and it's up to the medical staff to determine the cause of your symptoms or illness.